So interesting for me, when I started making content on YouTube, I would get a lot of comments. And one of the comments I would get was, how do I stop my nightfall? And this blew my mind that people thought that having nocturnal emissions or ejaculating at night was a bad thing. And like I had never, I just knew it was normal. And granted, obviously I'm a urologist, but I think I knew that from a young age because it's not not really taboo in the US. And it shocked me. And I was like, why are people are so stressed? How do I stop this? What's wrong with me? I'm broken. How do I stop this? And it was just a normal function.
Also, when you go on the internet, you'll find a lot of different stories about, if you get into the wrong line on internet, you can have a lot of things. Also, we see a lot of people now, young men that are referred with erectile problems, and then they go on the internet and they find, it's because I watch pornography. And I really disagree with that. Then they have all this shame about, I watch pornography. And we know that, 99.9% of men and a lot of women have watched pornography. And then they get this impression, I have to stop that. And then there's a lot of shame, a lot of anxiety. So we need to deconstruct all these shameful perceptions of, now I ruined my sexual life because I've masturbated, I watched pornography. And so it people becomes very anxious, and they're very anxious about, do I do it right? And we always think that what's happening in the neighbor's house is much more good or nice or more exciting than what we are experiencing.
Yeah. There's science that shows that pornography is not the problem, right? I don't think it's just your personal opinion. No. I think there's real science behind the fact that it's not the actual visual aid that you're using that's creating dysfunction. It's the moral incongruence. If you feel that pornography is bad, that's when the shame spiral creates this problem where you feel negative after doing the act of masturbating while you're watching pornography. And then you continue to do it to feel that little bit of dopamine. And then it just becomes this vicious cycle.
Yeah, and I completely agree. And I think there was a very nice study. I don't remember the authors, but they showed that young men that were anxious, so they were the one that, when they had watched pornography and masturbated, then they felt a lot of guilt and shame and anxiety. But the one that weren't anxious and had no problems with anxiety, they used it and they felt good. And then we know there's a lot of research. We have one researcher, Dr. Hall in Denmark, that did a lot of research on pornography. And he actually, there might be a small group that watch too much and have a vicious circle and watch more and more violent pornography. But it's not only pornography. They have a lot of other alarming signals. So it's not pornography alone, but they are the one that you should be a little bit concerned about. But that's really a minority.
Yeah, there's often a lot of concomitant depression and psychological factors, right? And there's sort of, maybe there's a theory that there might be some untreated psychological factors that they're self-medicating almost with the pornography. And I think the other thing is there's so much information online, right? Quit pornography. How do I quit? There's coaches who are take my 10-step program to quit pornography for good. And those don't even work, right? There's science that actually, there's evidence that doing these sort of very drastic interventions of complete abstinence don't actually work.
Yeah, and that's... it's talking against research, actually. And it's talking against what we would like to, be sex positive, and it becomes a very negative thing. And you have this 12 steps or 10 steps programs, if you have been drinking or taking drugs or something like that.
Yeah. And it's easy to, it sounds good, right? You're this morally righteous person saying porn is bad, it's ruining your life. If you quit this, you're going to have a much better life. And I tell people, look, if you cut back and you feel better, great. By all means, you don't have to watch pornography, but you shouldn't feel shame about it.
I think the shame is really bad for sexual health.
You did mention that there are changes that happen in sexuality as we age from a biological standpoint. So can we go over some of those?
We know there are changes in hormones. We know that in women, we have the decrease or the lack of estrogens after the menopause, which has an impact on especially lubrication, but also somehow on desire. We know something happens with desire when women go into the menopause, but especially it has an effect on lubrication and pain and feeling dry. We know that testosterone is declining both in men and women. We know that has an impact on desire. So we have the hormonal changes. We have just the fact that you need more stimulation, and that goes for both men and women. We need that men need more stimulation to have an erection. They need more stimulation to have an ejaculation, and maybe it takes longer time before they can function again.
Yeah.
So when they were used to, when they were 18, it only took 1 minute and then they were ready again. Now sometimes it takes a week because the whole system is like slowed down. So it needs more stimulation. It takes longer to recover. And it's the same with women, that women can still lubricate when they go into the menopause, but it takes more stimulation. And I think that's where some of the problem starts with people that get older, that they are doing what they used to do. And suddenly what they used to do is not good enough.
Yeah.
And then it's very, very difficult to say, I actually need more stimulation. I'm not just turned on by you saying, oh, should we do something? And then it's very difficult to find out, how do we do that stimulation and how do we talk about it? How do we help each other in finding out what do we like now? And it takes longer time. So I think that's the major changes. I mean, we have the hormonal changes and more physiological changes with the genitals. And then we also have the more psychological changes. Maybe people have known each other for a very long time. If they're still in the same relationship, we're always doing the same things. You might feel older. Your body image might change. Yeah, you only asked about the physical ones. Now go into the other ones. So and also the internalized ages. I mean, do I think I can have sex when I'm older? Do I like my body? Do I like my partner's body? So also, oh, now I'm getting old. You're a little depressed. I don't have a long time. I'm getting older, and all the more psychological things. So I think, and also the change in roles, that children are leaving home. What is my role now? How do I have a value? I stopped working. So it's really like the whole psychosocial approach is like a lot of things happens when you get older. So there's a physical thing, which can be quite dramatic. And then you have all the other aspects that's also are very important. There was a very nice study by Lorraine Dennerstein, who was, she is still there, but she did a study a long time ago looking at estrogens and women's sexual health when going into the menopause. And she found out that the psychological factors are just as important for desire and pain as the decrease in estrogens, meaning that the transition of becoming an old woman, now I go into the menopause, is much as important as the more physical factors.
I think that's so important to emphasize because I think of course, as physicians, we focus on the things that we can fix with a treatment, right? But I think the other things, the psychological factors and the stressors are different, right? As you mentioned, you go through retirement, perhaps you don't feel as much purpose. And I think that's a big thing that we don't talk about enough, right? That when you go through retirement, if you don't have a plan, you can only golf so many days, you can only travel so much. Like you need to feel like you have a purpose. And I think a lot of my patients come in and I feel like they really don't have one. And that's really a big struggle.
Yeah, so it's both about mental and physical health. And then we, of course, know that when you age, the risk of having cardiovascular diseases, rheumatoid arthritis, and a lot of diabetes, I mean, they also have a negative impact on sexual health. So we know that physical health declines with age for a lot of people. And there's some very nice study by, her name was Lindau, where she looked at how long can you expect to be sexually active, and she can show that it's correlated to how physically healthy are you. So if you have a good physical health, then you are have a higher chance of being sexually active a longer time when you get older. So they go hand in hand, and just the feeling of not being physically fit like you used to be also have a psychological impact. So it goes hand in hand.
Yeah, there's so many things. I did want to point out the stimulation thing, because I think people feel like there's something wrong with them. But just like you're aging, your nerve cells are aging, right? So they don't respond the same as they used to. And that's kind of, I don't think that we yet have anything that can combat that. Right? Like, I don't think you can't exercise out your nerve cells to work better. Those things will help potentially, but they're not going to completely eliminate aging of the nerve cells.
No, but we know that there is a little bit you can combat, but I agree with you. I mean, we have to recognize we're getting older and it works differently. I mean, it does on many other levels, but and then you need to change your sexual script. You need to change that. We need to do something differently. And I think it's, as we discussed, it's difficult to communicate about. I think I see a lot of women that if the man's starting having erectile dysfunction, they think, oh, something is wrong with me. He is in love with someone else. He's not attracted to me anymore. And she might have body image concerns because she's getting older. She might have gained weight. and then he's not able to have an erection, and because he needs more stimulation, or he's just have a decreased function of his erectile function, and then he thinks, oh my God, now I'm not attractive anymore, and he becomes very nervous because he knows that he's going to confirm her, well-being by having this erection. So there's so much pressure on it functioning. So
It
we
really
really
is.
need to you can help people if you tell them, actually, that's what happens when you get older. It has nothing to do with you as a partner. It has nothing to do with you. It has to do with becoming older.
Yeah. I think nowadays we're talking a lot about testosterone declining. And while we know estrogen declines to zero, basically for women, testosterone declines at a sort of expected rate per year. But there are things, so in general, most people should not need testosterone replacement if they are healthy, functioning, normal individuals. Would you agree with that?
Yeah, I would. And we know that especially if you're overweight, that testosterone is lower. So we might be able to help ourselves by staying fit and staying not too overweight. But it declines with age.
Yeah.
And I'm a psychiatrist, so I'm not really an endocrinologist, andrologist. But I think that for most people, we don't need to supplement anything. And I think we need to see in other factors, because it's also, I think we all want the quick fix, but sometimes you give testosterone to people and nothing changes. So you need to focus on, okay, then what was it then? And for some people, it's very, very good. And for some people, you need to look at something else. You need to look at what's happening in their relationship. Do they have a depression? Are there other factors that are more important than the testosterone?
I mean, I think we know that low testosterone is becoming more common because of all the comorbid conditions, right? Because people have more high cholesterol, more diabetes, being more overweight. And so getting to that level where testosterone becomes low enough to create problems is more common. But I just want to reassure people. I think my point is to say that, yes, we know that there is a hormonal decline, but if you remain healthy in your body and you're exercising and you moving your body and doing all the things that you need, eating correctly, that you should be able to maintain a reasonable amount of testosterone.
Yeah. And sometimes it's a little bit easier if sometimes people come into the clinic and say, they just wish it's the testosterone, because that's the easy thing.
Yeah.
That you, okay, then you can have a supplemental testosterone, and then everything is fixed. And then when we say, no, your testosterone is normal, or we don't think it's that, then it's really difficult, because then what?
Yeah, absolutely. What do you think in terms of a psychological standpoint, what helps older adults sort of reclaim their sexuality the most in terms of people who are struggling?
I think that communication is a good thing, both communication in the couple, but also communication with healthcare providers, that you are assured that it's okay to have the desire for being sexually active, that it's something that's normal. I think normalizing and communication that's very, very important, because then people can start helping themselves. A lot of people, they really, if you speak to them, they're very capable of thinking about what's the problem. And if you give them like a safe space where they can discuss it together, or they can discuss it with you, I think it's a lot of people can see, okay, I can see that maybe we should do a little bit more of this and a little bit less of that, and put more focus on intimacy. And I think that can help a lot. So basically, I think sometimes it's not very drastic what you have to do, because you can help people with education and information.
If you like that clip with Dr. Giraldi, check out the full episode right here.